Dr. Rosalynn Austin, and I'm here at the Heart Failure Association World Congress put on by the European Society of Cardiology. Now, while I'm here to present some of my own research as a moderated poster, I also thought that I would see and talk to some other researchers to see why they are doing heart failure research. Come along with me and see what they say. Now with me I have our president of ACNAP. Tell us who you are.
Okay, thank you for the invitation for this talk. My name is Izabella Uchmanowicz. I am present ACNAP president, which means Association of Cardiovascular Nursing and Allied Professions within European Society of Cardiology. And I also work as a researcher and a cardiac nurse at the Wrocław Medical University in Poland.
Oh, thank you so much for taking time, Izabella. I just watched you run from like one session to the other. I can't even imagine how busy you are today. Can you tell us and everybody who's listening why heart failure research for you as a nurse?
Maybe this pathway was done because my boss, my rector, professor, is a cardiologist who is mostly involved in heart failure, and I have found out that it's also the area that I am interested in, and also because we work a lot with heart failure patients, and we are trying to improve their lives care in Poland that we provide for them, so it's how it came.
Do you think that nurses, opposed to dietitians, cardiologists, electrophysiologists, do you think we have something extra that we bring to research that without us, research is not as good?
Yeah, I think we are all wonderful as a multidisciplinary team, but we have something extra. I think we are very hard workers. We like work with details, so we are very good in gathering the data. Maybe also we can say we have more time, and maybe we are more careful searching for the data and then gathering the data and evaluating the data that we have. So actually I think we are in a perfect position to help in research.
I couldn't agree more. The more nurses we get involved in research, the better. I'm going to let you run. Thank you so much for the time.
Thank you, Rosalynn, for the invitation.
My pleasure. I'll see you soon.
See you. Thank you. Bye-bye.
Right, next I have found somebody else to tell us why they do research. First off, who are you?
So I'm Nicolas Girerd. I'm a professor of medicine and a heart failure specialist in France. In Nancy, I am the head of the Clinical Investigation Center on cardio-renal interactions at my institution.
Thank you. And for you, why do you do heart failure research?
Heart failure is a major problem for mortality, for hospitalization, for the public system, actually in light of the money involved with hospitalizations. And I'm doing research to try to, at my own little scale, try to improve that, decrease morbidity, decrease mortality, and improve the overall system. We are doing that at different standpoints, I would say. So with new biomarkers, the new use of imaging with therapeutic avenues, and with a very broad analysis on the healthcare system itself for heart failure management.
I'm going to cheat and ask one more question because I really enjoyed your Telesat study. What do you think the role of electronic and remote monitoring is going to be in heart failure, both clinically and research, in the next couple of years?
Well, that's a tough one, but I am a strong believer in RMP. I think it's really the way to go because hospital beds are shrinking. We have less and less people in the hospital. We should find new ways to manage people distantly, and RMP for me is the way to go.
Thank you so much, Girerd, and thank you very much for your talk on Telesat. I look forward to reading the paper. Thank you. I've got a superstar with us. I've got the winner of the ACNAP nurse presentation here at the Heart Failure Association. Tell us who you are.
My name is Linn Hoog. I work as an assistant university nurse at the Karolinska University Hospital in Stockholm, Sweden, at the cardiology department and heart and vascular center.
Oh, wow, that's really cool. So then, why heart failure research?
I think it's such a huge part of our population, and they're growing, they're getting older, they're getting sicker, and it's also a group of patients that's very dear to my heart. I have worked with these patients for 12 years, and I see such a potential in the difference that we make as nurses. So, if not me, then who?
Oh, I love that. So you were a clinical nurse first before you transitioned into research, and now you're doing research. Is that full-time or part-time?
I'm still clinically active, so I have research part-time. So right now it says 50% and 50% clinical work. So where I work as an assistant university nurse, so I work a lot with heart failure patients and developing treatment strategies for these patients and nursing strategies, really.
Oh, that's perfect. Thank you. That sounds like an amazing thing, like to do 50-50. That's great. Lastly, I can't let you get away without telling us a little bit about your now award-winning research, worldwide recognized nurse leading research. Tell us about that research.
Well, we performed a national survey of healthcare professionals' clinical practice on fluid intake, and that is also raised from a clinical perspective and a clinical need. I saw a problem in clinical practice regarding fluid restriction and fluid intake in these patients, and so at first we thought that there might be an interest and there might be a need to study how do we actually manage our patients in clinical practice, because we might have an idea and an hypothesis that might be in a certain way. So to bring more evidence to that in order to perhaps affect guidelines and care programs, we performed this study.
I love that. Do you think, in reality, like what you've got set up, that 50-50 split, do you think nurses are best placed for answering some of these really practical day-to-day questions when it comes to management of healthcare?
Definitely. I think that nurses are underused in research. I think that nurses does not particularly have to be front runners in research, but I think that there is a huge gap in not involving nurses because we are two different professions. So we work in different ways. We see our patients in different ways. So I think that it is, if not equally important, even more important to bring in nurses' perspective.
Oh, I totally agree with you. You're preaching to the choir, though. Thank you so much for taking this time with me. And again, congratulations on your award. That's great.
Thank you very much.
I found somebody else to talk to. Who are you?
So I'm Lorena Hill. I am a heart failure researcher from Queen's University in Belfast.
Hi, Lorena. So why heart failure research?
So, heart failure research, I've been a heart failure nurse for nearly 20 years, and these are patients who are really symptomatic. So when you see them at clinic, they have got poor quality of life, a lot of symptoms that really should be better managed, better cared for, and they're a growing population, not only just within the UK where I work, but also globally.
Fair enough. So, you're a nurse and you do research, and you're here at a conference. Why do you think it's important to have nurses do research in heart failure?
So as a nurse, we not only manage their heart failure symptoms, but we manage them as an holistic person. We manage not only their heart failure, but we manage other comorbidities they may have.
Yeah.
We take into account their socioeconomic circumstances. We look at their caregiver support. We look at, so we're doing some different research that I've seen yesterday and today has looked at caregiver support and how that makes a big difference.
Yeah.
So as a nurse, we not only manage and make sure that the patient's on the right guideline-directed medical therapy, but they're getting the appropriate care to ensure that they stay well. So we are good researchers of patient care.
Next up, we finally meet in person. Rhys, can you tell everybody who you are?
Yes, hi, my name's Rhys. I'm a specialist pharmacist in cardiology and more specifically heart failure in Bridgend from South Wales.
Excellent. Thank you so much for joining me. Can you tell everybody why heart failure research for you as a pharmacist?
Yeah, so there's a couple of reasons. So the local population that we serve, multiple comorbidities, quite a socially deprived area. So actually trying to improve population health in that locality is quite a challenge. a lot of these patients do have a diagnosis of heart failure, and optimization of their medicines is quite key. So clinical practice-wise, heart failure was a very interesting area to go into, multiple medications, etc. So pharmacists can become heavily involved. The research element, I like answering the questions that haven't been answered yet. So it's great to see, how can we involve pharmacists in the MDT, looking at how they may benefit, and also clinical outcomes as well with regards to use of medications that in practice not many organisations are using at present, so we're heavily involved with using potassium binders. We have small numbers of patients on vericiguat, so it's trying to get that information out there and just show what these medicines can do in real world.
So you say you're from Bridgend, small community in Wales. Do you believe that because you, as a pharmacist, are engaged in research activity, that though that community is now getting a different standard or more options in their care than if you weren't?
I think trying to keep up to date and knowing all of the potential options out there. I mean, we talk about heart failure clinicians are all going to be well versed with 4-pillar therapy and trying to optimize, but it's about how you can achieve that in reality. So there's two elements. It's the clinical outcomes, which may come from sort of weird and wonderful therapies, which not many centres use, but also allowing people to see what pharmacists can provide to the MDT and how that can kind of accompany existing services and improve existing services.
I'm sure you're a real inspiration to lots of pharmacists out there. Are you presenting at this conference this time?
So no presentation this time. We have had a poster on display showing how pharmacists can help.
That's a presentation.
Yeah, so how we can reorganise the local heart failure service, which has also then allowed our heart failure specialist nurses to provide more in-reach services, same-day appointments for those that have worrying symptoms. And we've managed to bring down waiting times as part of that kind of multidisciplinary response. So it was fantastic to see how we both complemented one another.
Very cool. Thank you so much for your time, and thanks for joining us again on the podcast. You're a repeat visitor now.
Always welcome. So thank you very much.
I found somebody else to talk to. Tell us your name and where you work.
Hi everyone. Hi Rosalynn. So I'm Sarah. I'm a heart failure specialist nurse in the community in Imperial, and I look after heart failure patients in a community setting.
Oh, excellent. So why are you here? If you're a clinical nurse, why are you at a research conference for heart failure?
So because I think that nurses don't lead enough research that's truly nurse-led, and also because there's not enough trials in the community for community-dwelling patients. Most of these trials are done in controlled settings, and it's important that we really capture the true characteristics of these patients.
Oh, excellent. Now, I heard a rumor that you actually were presenting some research today. So can you just tell us really quickly about the research that you presented here at the conference?
Yeah, so I did a moderated e-poster, and it was looking at describing the clinical outcomes of HFpEF patients referred to a community nurse-led clinic, as well as the heart failure specialist nurse interventions during a 6-month period of data. It was a longitudinal cohort design, and we had some really interesting findings that are really characteristic of the community-dwelling HFpEF patients.
Excellent. I can't wait to read the publication. I'm really looking forward to seeing that. One last question. Nurses. We've been here at the conference today, and there are some who are out there who are doing research, who are presenting, but not that many. Do you think that nurses belong in a Heart Failure Association World Congress for Research?
Absolutely. So happy International Nurses Day to everyone.
Oh yeah, it is. Happy International Nurses Day at the time of filming.
We definitely need more nurse-led research, whether you're in a clinical setting or a research setting. We need to start thinking outside our box, and also we need to start conducting our own truly nurse-led, not just clinicians doing interventions that could be applicable to nurses, but we actually in a prime position to capture data and to really change patient outcomes.
Oh, sounds amazing. I'm so looking forward to seeing the research that you produce and to watching your career grow as you progress.
Thank you.
Thank you for the time, and enjoy the rest of the conference.
Thanks, everyone.
With me now, I have a molecular biologist who's also doing research in heart failure. Tell us who you are.
Yeah, I'm Iram Murtaza, and I'm currently the professor and HOD of biochemistry in Quaid-e-Azam University, Pakistan. So I'm doing work on the molecular biology of the cardiovascular diseases and also the associated diseases like diabetes linked to the cardiovascular diseases and different other diseases which can link with the cardiovascular diseases.
Wow, that's incredible. That sounds like really, really cool. So for you, why have you decided to do molecular biology research within cardiovascular? And as you're here presenting, you just did a great presentation on heart failure.
Yeah, basically my passion starts back from 1999 when I studied and started studying about the molecular biology of the CVDs and cancers. And later on, I did my MPhil PhD from the CAS on the molecular biology of the CVDs, specifically myocardial infarction.
Okay.
And then I did my postdocs in one in the CAS and one in GT HSC, sponsored by NIH America. And it also based on the metabolism and the cardiovascular interplay, disease interplay. So, and still, we are working on digging out certain microRNA-based molecular biology signaling, which can link in the future for the better and precise diagnosis of early cardiac failure or heart failure.
Oh, wow, that's so cool. So you just presented here at the Heart Failure Conference. Just really quickly, in a couple of minutes, were you presenting about that? So those micro signals that you believe might help us better detect and diagnose heart failure, because it's a major problem in heart failure. It takes, like, as a nurse, so often by the time somebody gets diagnosed, there's already been so much damage that's happened. So hearing that you're trying to solve that problem is brilliant. So for everybody out there, just tell us a little bit about what your research was and how close you think you're getting to being able to have a microRNA signal that we'll be able to use diagnostically.
Yeah, half of my answer is in your question. It's great that you ask the gap. The gap still is here because, for example, if a sudden cardiac arrest happened or myocardial infarction, so usually the first approach is to go for the TROP-T test, let's say, and the other tests which are like that. But these are the signals of the post-infarction, post-heart failure. But in the case of microRNA-based genetic analysis, it can be done quite early. For example, if any patient, an individual who has a genetic predisposition or not, for example, they are suffering from the hypertension, they're suffering from the diabetes, they can go check their blood test with the specific microRNA which we are working, for example, and if that microRNA overexpression or dysregulation get pop up, okay, fine, it's a sign for them to get ready and get precautions ahead so that they can get prevention against the in the future attack of the unfortunate attack of the heart failure. So it's an early prediction markers. Genetic predisposition can be assessed, and also there will be a much more peace of mind on the end of the clinicians, on the end of the nurses, and also definitely the patient.
Oh, fascinating. I can't wait to read more about it. Thank you so much for taking time out of this busy conference, and I look forward to hearing more about your research in the future. Thank you.
Thank you so much. Thank you. Thank you for giving me a chance in the podcast. Thank you so much.
Next, I have a professor of nursing with me. Tell us who you are.
I'm Anna Stromberg, and I'm from Sweden, from Linköping University and Linköping University Hospital.
Thank you very much for joining us, Anna. Can you tell us, for you, why do you think nurses should be involved in heart failure research?
I think the heart failure population is a very important cardiovascular population. There are a lot of issues where nurses can make a difference. But in order to know what we should focus on, we need research to evaluate various type of interventions. And we also need research to explore patients' experiences and life situation. So there are many reasons why nurses should do research in heart failure.
I totally agree with you. What, for you personally, was the thing or event that brought you as a nurse into research?
Well, I was part of starting up the first nurse-led heart failure clinic in Europe.
Oh, wow.
That was actually in Linköping, Sweden. And I gave a lot of presentations on how we worked, and I always got the question, well, is it effective? So I really tried to make some people evaluate it, but no one was interested. And at the end of the day, one of the cardiologists that I worked with said, like, why don't you do it? And I thought, I never thought of doing a PhD, but I really had a research question that interested me. So that was kind of my trip. And then I came to my first ESC meeting, and there I met Tini Arsma and other people that were interested in heart failure as well. And then I realized that I was not alone, and other people were interested in this research question as well.
Oh, that's so cool. Thank you for sharing your personal story into research, and thank you for sharing a few minutes of your time to share with me and everybody out there your journey into research and why you think it's so important. Thank you so much, Anna.
Thank you.
I found some people. So tell us who you are.
Professor Maciej Banach from Medical University of Lodz. I'm preventive cardiologist and lipidologist.
And?
Professor Agata Bielecka from Medical University of Łódź and also Polish Mother Memorial's Hospital. And I'm head of Department of Cardiology.
Oh, great. Thank you for agreeing to take 5 minutes with me. So, top question. Why heart failure research?
In fact, I am not a heart failure researcher, but I would like to do everything in order to prevent heart failure. So that is why I'm very much focused in order to avoid the first event or delay the time for the first event, and to be very effective with the diagnosis, early diagnosis and treatment after the event, in order to avoid the heart failure. Because you know it very well that in Poland we have over 1 million people with heart failure. So if we are effective in the prevention of heart failure, for example, with the upfront intensive lipid-lowering combination therapy, with the intensive, very innovative drugs for diabetes, for hypertension, I am very sure that we can reduce the burden of the heart failure problem in Poland, and that is why I am involved in the research in order to prevent heart failure.
Thank you so much. And Agata?
As Professor Banach told us, more and more people will be suffer from heart failure, and this huge number of people who have problems with this disease. And our mission is to try to improve their prognosis and also their quality of life, and also the treatment strategies. That's why our plan for future are research in this area.
Oh, thank you so much for letting me know why you do research. Thank you.
Thank you so much. Thank you.
Thank you.
I found another nurse. Let's see who she is and what she does.
Thank you. My name is Naoko. I'm from Japan. I'm currently working in Sweden, in Linköping University.
Oh, that's so nice. So why research for you?
I think the research is important to develop or improve patient self-care for heart failure patient.
Oh, that's perfect. So you're here. Are you just attending or are you presenting any research?
I have a presentation today.
Woo! So what are you going to be presenting about?
My research is about how to help to assess the patient heart failure stages.
Oh, I can't wait. I will make sure that I'm there so that I can find out more about it. And the abstracts and stuff, I'll put a link in this podcast so that people can see your abstract as well, okay? Thank you so much.
Thank you.
Next up, I found somebody at a heart failure conference on research that isn't a doctor, isn't a nurse, isn't a pharmacist. So, who are you and what do you do?
Hello, my name is Andreas Blomqvist. I'm an electrical engineer by training. I also got a business degree, believe it or not. But so I digital signal processing and statistics and basically maths and physics. That's my history. Although right now, getting a PhD in medicine, believe it or not.
So that is intriguing. And while we don't have time today to go into the whole depths of that, why heart failure research then if you're business and electrical engineer?
Right, as I guess for most people here in life, you slip on a banana peel that takes you left or right. And after college, I just ended up landing my first job at St. Jude Medical. and the research department. So, 1, 2, 3, I was a research scientist, didn't know much about that, just doing like impedance or ECG analysis, signal processing, right?
Yeah.
And, 20 years down the line, I just got stuck doing clinical research for heart failure patients. And I think that what kind of keeps me going in that field is there's such an unmet need for the really old ones that my heart goes out to. There's like, but next generation will be good with digital stuff. So, and they're kind of like forgetting about these people that are dying by the minute, going in and out of the emergency room. So I think there's a lot we can do for them, and that's kind of my driving force at this point.
I absolutely love that. So I recently went on holiday to Korea, and one of the things that blew my mind is that actually there in Korea, unlike everywhere here where everybody says exactly what you say, old people can't use tech.
No.
On the public transport, the amount of people who were easily over 75 who had smartphones with wireless Bluetooth headphones on in the tube. And I think we often, personally, I'll ask you, do you think that we underestimate what the older adults can do with digital tech in heart failure?
Yeah. Well, yes and no, but I'm going to challenge. I think that the question is not really right. I don't think it's tech that is the thing. The tech that is being thrown at them, I don't believe that that's made for them. So I think that when you throw a lot of the stuff that's being thrown at the 90 years old right now, they can't use because it was made by 32-year-olds, for 32-year-olds. We can use tech that is made for 90-year-olds and make it easy peasy. So tech always age faster than people. 20 years ago, 15 years ago, there were no tablets. The people who are 90 now, it was 30 years ago that they were 60. I was in kindergarten. Not quite, but, somewhat, yeah. So it's like, because of that, we just have to make sure who are we designing this for.
Oh, I love that. User-designed health tech. Sounds great. I'm going to let you go because the next session is starting. But thank you so much for taking a couple of minutes to tell us and share with us all who you are and why heart failure research.
You bet. Thank you very much. Have a good one.
Found two more nurses who do research. So can you tell us who you are and where you're from?
We are from Poland, from Wrocław.
And your name?
My name is Marta.
Marta?
Magda.
Magda. Hi, nice to meet you. So, why do you do heart failure research as nurses?
Our research are associated directly with our clinical practice. So this area of research is for us the most important, I think. I want to add that we are heart failure nurses. So we educated patients. We worked in the outpatient heart failure clinic. So in our daily practice, we work with patient heart failure.
That's incredible. So in addition to doing research, you're also working clinically. Do you get protected time to do the research? So do you do it as part of your job or in your free time?
Yes, this is part of our job. Yes. Additionally, we work in the Wrocław Medical University, so we worked with patients in the practice and in the research area also.
Wow, so busy ladies. Do you think it's important that we get more nurses involved in doing research?
Yes, of course. The needs of patients with heart failure is still rising, so the nurses should be involved in research and to help patients understand their needs.
I couldn't agree more with you. I've enjoyed both of your posters and your presentation. Congratulations, runner-up. Yes. And enjoy the rest of the conference.
you.